Hello, I'm Dr. Roberto Carricchio. I'm the chief of the Division of Rheumatology at UMass Chan Medical School in Worcester, Massachusetts. And I'm also the director of the Lupus Center at UMass Chan. I'm joined today by Miss Ruth Wilson, who's a patient with lupus, but it's much more than that. She's also a very strong advocate at the national level with a number of foundations, and also the director of our lupus support group in our center. Ruth, welcome.
Thank you so much for having me, and thank you so much for that very gracious introduction. I really appreciate your invitation to be here today.
Do you think, have you experienced differences between regular clinics and highly specialized centers? Lupus is a borderline rare disease. So roughly 500,000 people, or anywhere between 300 and 500,000 people right now in the United States have systemic lupus erythematosus. And do you think that there might be a difference to seek a more specialized center, at least at the beginning, rather than not?
Absolutely. I think the more specialized treatment that you can get, the better, right? Because especially, if you still don't have organ involvement, you want to make sure that you're getting the best care that you can before those things happen, right? You want to stop organ involvement. And I think being in a center that is specialized on lupus gives you an opportunity to have access to doctors that really understand what's going on with your body, and be able to refer you to other specialists like a nephrologist or a cardiologist or a GI doctor, or if you have skin lupus, to a dermatologist. But really having that expertise is super important.
You bring actually a very important point. The nature of lupus disease requires a multidisciplinary approach, meaning multiple doctors taking care of the patient, depending on the manifestations. How would you suggest patients, in case they have the need of multiple doctors, to coordinate the care? Is there a tip that you successfully applied for that challenging situation?
I think it's becoming a little more easier now, with things like Epic, where doctors are all talking to each other and can see each other's notes. But definitely getting into a center that has all those doctors makes it a lot easier. Because they can connect, they can talk to each other, because you really do need to have that strong team. When you first become diagnosed, I don't think anybody understands that you're going to need a team of doctors, not just your rheumatologist, but a lot of different ones, depending on how your disease goes and what other things get involved within your disease. So I think it's getting better now that, like I said, doctors are talking to each other more. But definitely, keeping track of all your appointments and keeping track of all your records if you're going to go the route of having doctors in different locations. But I would highly recommend that, that all your doctors are within the same network, so that they can collaborate and really provide the care that you need.
Very well said.
Thank you so much for having me. This was a very useful information, that I hope helps other lupus patients. So thank you so much for having me.
Thank you. And let's thank also the audience that has joined us today to listen to us, and especially to your story. Thank you very much.